Why do antidepressants trigger mania in bipolar disorder? Imagine your brain as a finely tuned orchestra where many instruments work together to keep your mood balanced. In bipolar disorder, this harmony is disrupted, causing shifts between depression and mania. Now, antidepressants are like a new instrument added to the orchestra, but sometimes they can cause the music to become too loud or chaotic. This happens because antidepressants change brain chemistry in ways that can upset the delicate balance needed for stable moods. At the core, bipolar disorder involves complex imbalances in chemicals called neurotransmitters, which are messengers in the brain. These include serotonin, norepinephrine, and dopamine. These chemicals regulate mood, energy, and impulsivity. When someone with bipolar takes antidepressants, these medications increase the availability of certain neurotransmitters to help lift depression. But in some cases, this boost can overshoot, leading to excessive stimulation of brain circuits that trigger manic symptoms like elevated mood, high energy, impulsiveness, and less need for sleep. Another important factor is how antidepressants affect the energy production inside brain cells. Some medications enhance mitochondrial activity, which is how cells generate energy. Research shows that antidepressants increasing mitochondrial energy may double the risk of triggering mania in people with bipolar disorder. When brain cells produce too much energy, it can make the brain more active than usual, pushing someone into a manic state. The type of antidepressant also matters. Older drugs like tricyclic antidepressants affect multiple neurotransmitters broadly and tend to have a higher chance of causing mania. Newer medications called selective serotonin reuptake inhibitors mainly increase serotonin levels and are generally considered to have a lower risk, but they can still sometimes cause mood destabilization. Serotonin itself plays a complex role in mood regulation. While low serotonin levels are linked to depression, an imbalance can also contribute to mania. Increasing serotonin levels with antidepressants might sometimes interfere with the brain's ability to control impulsivity and mood swings, leading to manic episodes. Individual factors also influence risk. Younger people, women, and those with a family history of bipolar disorder are more susceptible. This is because their brain chemistry or genetics may respond differently to these medications, making them more prone to mood shifts. To reduce the risk of antidepressant-induced mania, doctors often prescribe mood stabilizers or antipsychotics alongside antidepressants. These medications help balance neurotransmitter activity and support mitochondrial function, providing a protective effect. However, they do not eliminate the risk entirely, so careful monitoring is essential. Some studies suggest that the risk of triggering mania with antidepressants is relatively low and that mood episodes might sometimes be part of bipolar disorder's natural course. Still, because manic episodes can complicate treatment and worsen the illness, medical professionals exercise caution. In summary, antidepressants can trigger mania because they increase neurotransmitter activity and boost cellular energy in the brain, which can destabilize mood regulation. The likelihood depends on the type of antidepressant, individual biology, and whether mood stabilizers are used. This highlights the importance of accurate diagnosis, careful treatment planning, and close medical supervision. Always consult a healthcare professional to determine the safest approach for managing bipolar disorder, as each person's experience is unique and requires personalized care.